Good afternoon, everyone. Thank you for joining us for our September webinar. This month, we have James Butler from the U.S. Army Public Health Command, who will be speaking on tick surveillance in Eastern United States from a military perspective. So we're very fortunate to have him here today. This should be a great presentation for everyone. I'm hitting buttons, but nothing's happening. There we go. As always, we want to thank the North Central IPM Center for funding this working group and making these webinars possible, as well as the other work that we do. So we're very fortunate for them. And thank you. If there's any representatives from NCIPM here today, thank you for your support. The Tick Academy registration is open if you have not heard. If you have heard and you haven't registered, please register. If you have registered and you know other people who want to register, please share this with them. There's a QR code on the screen that if you scan right now should take you to the registration page. Otherwise, this bit.ly bit.ly/tickacademy24 will take you to the registration page. Otherwise, if you just go to the tick portion of the IPM website, that's the Tick Academy registration page. If any of you have newsletters or community meetings or anything like that, and you would be interested in sharing our registration information, please reach out to me. I will send you this graphic. I can give you some language to use in a social media post if you'd like to do something like that. But please share this with everyone in your network. And please attend the Tick Academy. We have some really exciting speakers lined up, and it should be a great time. So let me know if you have any questions about that. I can put my email in the chat real quick. If I can spell. There we go. So please feel free to reach out to me if you're interested in this graphic or helping to share this. So thank you. Please register. Related to that, there is no October webinar because of the Tick Academy, which takes place on October 16th and 17th. So get excited, tell your friends, and we'll resume with our regular webinar schedule in November. As per usual, please contact me if you are interested in presenting at a future working group meeting, or if you have someone in your network or an exciting project that you're aware of that you'd like us to reach out to. Any and all of the above, please let me know. As you know, we're interested in all kinds of tick topics, so shoot me an email. Do we have any updates from working group members? I'm sorry, I didn't quite catch that. Okay, well, if anyone comes up with any updates throughout today's presentation, either save them till the end or put them in the chat or send me an email and I can get them out to the working group. So thank you.
Well, there's 4 dead and 30 shot.
Moving on to today's speaker. Today's speaker is James Butler, who is a medical entomologist for the U.S. Army Public Health Command, where he trains environmental health personnel in integrated pest management and conducts management program reviews and consults on a variety of pest management and vector-borne disease issues across the eastern half of the United States. So thank you for joining us today. I'm going to launch the poll question, and then it'll be all you. Hopefully everyone can see that. Looks like people are answering, so that's good. As always, if you have questions for our speaker throughout the presentation, please feel free to either save them till the end or put them in the chat as they come up. I will be monitoring the chat as best as I can. And I think for the most part, we'll do questions at the end, but make sure to write them down so you don't forget. Looks like most everyone has answered the polls. Thank you for doing that. Pin your screen. James Butler, everyone.
All right. Well, thanks for joining in. We're going to kind of go down a rabbit hole of how ticks impact the military, specifically within my region on the eastern half of the United States. First thing I have to do as a government employee is give a disclaimer. This is my views. This is not the government, and I'm not endorsing or advertising any particular thing. Are we sharing?
Yes, can everyone see? I have you pinned, so you're the larger.
Okay, all right, because I see something different. Okay, as long as everybody can see, we're good. Okay, so a little bit about me. I'm an entomologist. I've got a master's degree, a bachelor's and master's in entomology, and a master's in education. And I've worked for the Department of Defense for 15 years at Public Health Command East. We've gone through a variety of different names over the years, but I've spent a good majority of my career doing this work. But prior to that, I was engaged in pest management and a few other entomology realms. But for today, we're talking about ticks. So for an agenda, I'd like to just do a very quick primer on ticks in case there's anybody on here that is not knowledgeable on ticks at this point. Then I'm going to go into why are ticks important for the military, and from there I'll go into my realm where me and the unit I work for, kind of what we do regarding tick management, tick surveillance, and then some case studies, and then I'm going to kind of end up with a little bit on tick resources for DoD personnel. I will say the poll, I was smiling when I saw that the vast majority of participants were aware of the MilTick program. So I like that we're getting that out there to the relevant tick people. Okay, what is a tick? Well, at its basis, ticks are external parasites. They require blood meals from their hosts. Why is that a problem? In general, that it's just a nuisance, but when we have pathogens thrown into the mix, and they become a vector of diseases, then that becomes a major problem. So tick-borne diseases. The dynamic aspect of what we understand regarding ticks and diseases that they can transmit, or the pathogens that they transmit to induce a disease, has changed over the years. This graph that I have currently up, it's a timeline kind of showing when various tick-borne pathogens were identified. And if you look here, you can see that Rocky Mountain spotted fever was the first tick-borne disease in the United States that we identified. And that's really only been a little over 100 years ago. So in the grand scheme of human evolution, history, we've only recently understood the dynamics of some of these diseases. Of course, you can look through this chart and see kind of when various diseases were identified, all the way up until the 1980s. We got Lyme disease identified in my particular area in the eastern United States, and all the way up into some of the later years. You can just see how dynamic this has been, and we don't know what else is out there that, well, we don't know yet. So this chart in 5 years could have 2 or 3 more diseases on there, or pathogens that that we don't currently know. So this topic, this realm, is ever evolving. Here's a chart from the CDC showing a few of the common tick-borne diseases. And the one thing that I want to point out is just kind of where those are located. And the vast majority of them are kind of in my region, my eastern United States. So where I work, in comparison to my regional counterparts, tick-borne diseases is a much stronger emphasis for me than some of my counterparts. Now, do all ticks transmit all diseases? I'm hoping everybody in this group is aware that no, not all ticks transmit all diseases. So it is important to identify what tick you have, and then you can do literature research and identify what potential diseases that tick may be transmitting, or the pathogens within it. This chart here, this shows the testing capabilities that my lab at Public Health Command East is capable of testing for. You see the pathogens on the left, and then the common ticks that we deal with within our region. And you can see that the vast majority of this says not a vector. So ticks are pretty specific when it comes to what pathogens they are able to transmit. I'm going to just go through those few common ticks that we mostly deal with within my region. First one is the Lone Star tick, and you can see the CDC graph here. These graphs, some of these are a little bit older. I went to the CDC website to get new ones, and for consistency, I kind of kept with the existing ones because not all of them were up to date. And then you can also see the diseases that they transmit or they induce. In the point of the Lone Star tick, ehrlichiosis is kind of the primary one that we've been concerned with. And then there at the bottom, the alpha-gal syndrome. You may or may not be familiar with that. That is not a pathogen. It is induced, it's an allergic reaction to tick bites, and then eating red meat, having a reaction, an immune response to that. But you can see Lone Star tick, it is well established on the East Coast, all the way up into northern New York area, and it is slowly progressing north up into those higher regions. Next is the American dog tick. Again, this one, eastern half of the United States, it's found throughout. And this is our Rocky Mountain spotted fever tick. It is the most common disease pathogen that this transmits. Next, we have the Gulf Coast tick. And this one's kind of an interesting character for me because I've been watching this tick traverse up the eastern seaboard. If you look at the map for the CDC, I'm in Maryland, Baltimore area, just a little bit north of Washington, D.C. And you can see the kind of the yellow haze of the map here kind of shows that it's kind of in our area. This is actually a little bit behind. I identified it first in Maryland way back in 2013. And we've been seeing it progress up that eastern seaboard a little bit more than what this map shows. We also, around that 2013 timeframe, collected it in Kentucky at Fort Knox and Fort Campbell area, which you can see the map here does not really reflect that. We have reported this, but it's not currently under the CDC's area of distribution. Next is the infamous black-legged tick, the Lyme disease tick. And it is pretty much, again, just like the others, pretty much covers my entire region. All right, that was a very, very quick overview of ticks and kind of the common ones that we deal with within my region. So switching gears a little bit here, why are ticks important to the Department of Defense? Well, as these pictures kind of indicate, ticks are in the areas where soldiers are often doing training exercises. I have some pictures varying from what we call land navigation. It's exercise where soldiers have to get from one point to another point in an efficient amount of time. You can see they're using the map here to try to triangulate where they are. Oftentimes, these training exercises are done in very high tick habitat. The soldiers doing it, they are moving pretty fast, but they are in the environment where they potentially could be impacted by a tick. We also have things like in the top right picture, more involved training activities where soldiers are getting in the ground. They may be sleeping overnight in an environment. They may be crawling on the ground like that. Basically, a lot of the training situations that occur for Department of Defense does involve human soldiers being in tick habitats. And when we're dealing with diseases, that creates a whole readiness component. So military is very big on what we call military readiness. That means at any moment, something could happen and the United States military would need to mobilize quickly. And military readiness is those soldiers being ready to go for that. A big part of that is their health. If they are impacted by a tick-borne disease, that can take them out of the fight and make our military less capable to execute whatever missions is needed. Now, that's not the only reason why ticks are important to the military. It's not just about the soldiers and the work that they are doing in the field. Soldiers do have to go through physical fitness. They have to maintain that readiness, that physical readiness to do their job. So they're often doing physical activities such as running, hiking, doing lots of things out in environments where ticks may be. But on top of that, well, it's not just about the soldier. It's also about the community, the entire DoD community. That includes the soldiers, their dependents, so spouses, children, sometimes parents, elderly parents, or it can be dependents, as well as people like myself, a civilian who works for the military, or even retirees that may come onto a military installation. We don't want to forget all those other people besides the soldiers that can be impacted by either living, working, or doing activities on military property. However, humans are not the only service members we have. We have a large contingency of military working animals, primarily dogs. We also have horses as well as a variety of other animals that are considered a service member. They are fundamentally, they are a soldier, and there are concerns with them just as well as any humans. So when we're looking at the threat of ticks, we kind of have this broad scope of soldiers, any civilians associated with it, as well as any animals. Which brings me to where I stand. So I work for what is called the Public Health Command East. And you can see here, this is our region. It's pretty much, it's everything in the continental United States, east of the Mississippi River, as well as a few areas in the Caribbean, Guantanamo Bay and Fort Buchanan in Puerto Rico. We as a region support those through our mission, which is Public Health Command East strives to ensure health and readiness, that's bringing in that military readiness of the warfighters, the Department of Army civilians, sometimes other services as well. So really, I would say DA civilian or DOD civilians, those beneficiaries to the service members, and any of the service animals that I mentioned before. And this is through a comprehensive public health services across all those states, as well as those few U.S. territories. Now, how does this work? Well, you can see here we have several installations, big installations, forts such as Fort Campbell, Fort Knox. These are our major locations for Army services within my region. You can also see there are a bunch of small yellow dots. These are kind of our satellite locations. They can be a smaller fort, they can be a depot or a arsenal. They may be fairly large, or they can be a very small area, but they're kind of our satellite installations from the bigger locations. So you can see those bigger dots, medical treatment facility. That's where the hospitals are. So we align very closely with the clinical hospital side of military health. And at those hospitals, we have installation level public health authorities. One of their roles is vector surveillance. So they're doing mosquito trapping, they are looking at ticks, and we as a region, we support them through a variety of activities, everything from training. We go on site to these locations and conduct specific training for that location, as well as any of the outliers that they may service. And that involves formalized classroom instruction, that involves site visits at locations across the installation to help set them up for that day-to-day work. They're there to take care of the entire installation, and we set them up with that. Additionally, we do other services such as a vector surveillance mission. We might go out and take a week at one of these locations and do very extensive surveillance for those vector-borne diseases. That's oftentimes based off of an elevated risk in the location. Maybe there's an outbreak of human cases in the region, and that can induce us to go and do these more specialized, in-depth missions. Other things we do are quick response missions. Now, not quite so much for ticks, but if there is an issue on a post, for instance, tomorrow I'm dealing with a bed bug installation issue that I will be traveling to and trying to help get that situation resolved. So that's kind of a broad overview of what we do within entomology, within Public Health Command. The last thing with that is bringing in the disease aspect. So our collaborators who go out and do the surveillance, they then send those specimens to us, and we maintain a pathogen detection lab to evaluate those and give that pathogen disease risk back to the installation so they can make informed decisions, not only on what is possibly there, but like what we are finding, like how prevalent is a pathogen within that installation's area. All right, tick surveillance. I am going to assume that the vast majority of you on here are at least familiar with tick surveillance. However, there may not be some, so I do want to kind of give a little background on the standard use of tick surveillance. So looking at this picture, like, how would you evaluate that location for the risk of ticks to military personnel doing a field exercise there? I'm willing to bet that you're probably going to go to the standard tick drag. This is kind of the go-to surveillance tool for ticks. And I've used it many, many times over the years. There's some pros to it. There's some cons to it. So what's a pro to it? Well, if you're doing scientific research, you're going to be doing some statistical analysis and you want to compare with other studies. This is a really good tool to use. It's been well established, and you can compare collection methods, collection data from using this methodology with other research. There are drawbacks to it, though. One, well, let's think about this. It's a drag. So just by name, what are you doing? You're dragging this cloth through an environment. You can see, the picture on the right here, this soldier, he's dragging it. So what can be a con to that? Well, you're putting yourself at risk. Whoever is doing the dragging is going through that environment before the material that we're trying to collect the ticks on. So you have a higher risk of ticks getting on you, possibly biting you through this method. Ergonomically, it's fairly cumbersome. Oftentimes, a standard tick drag is going to be fairly sizable. You can see the picture on the left here. It takes two people really to use a device like this efficiently. One's going to be dragging it, holding it up, and then another person will be looking at it to collect any ticks off of it. And then that's a limited scope. That using that device, there's only so many habitats that you can actually survey with a tick drag. So what do we use in other areas where a tick drag cannot be used? Oftentimes we're using flags. A flag, basically it's a pole with that same cloth material put on it, and you can poke it around and get in around vegetation. Supplements a tick drag fairly well. You have pros and cons with it. There's more habitats you can get to, which includes various other species. So you get a different collection of ticks using this device compared to the tick drag. But what are those cons to it? Well, still puts you in harm's way. You can see the picture on the right. The person doing that flagging is getting up really close to that vegetation. So you do have that risk of putting yourself close to the environment. It is fairly cumbersome. He's kind of leaning down. You do a full day, and if anybody on this webinar has done a full day of tick work, it gets tiring. You also have limited scope with this one, and then it is a little bit less standardized. So scientific research, it's very user dependent in how this device is handled and used. So doing a scientific comparison, you have to take that into consideration, that it's a little bit more free-form in its use than the tick drag. So I've talked about the two primary methods that people use. Well, that's not what we use. In fact, I have not used a tick drag or tick flag in close to 10 years. What I like to use is a tick sweep. Now, this is a kind of a screenshot of a paper put out way back in 1992 by a couple of entomologists working for USDA, and they evaluated a tick sweep device. Primarily, their research was looking at nymphs of deer tick, or called the black-legged tick, but they found it to be very effective. And I was looking at this earlier on in my career. Some of the people I'd worked with were involved in this study. And I'm like, you know what, let's make some, let's try it out, and let's see how that works for our particular needs. And we've come to realize that it works very well, kind of doing a cross between the tick drag and the tick flag, depending on your technique. Now, how is it constructed? Well, the versions that we are using are kind of modified from the one in that paper. We're using sections of PVC pipe with fittings put on them so that it's easily transportable. We're oftentimes hitting the road and need our equipment to be very mobile. So we've developed a small packaged unit that can be easily thrown in a suitcase and traveled with us. Um, the flagging material, I know tick drags vary between cotton material that will pick up every little stick and leaf in the area to a canvas material that ticks may or may not be great at attaching to. Well, what we found works really well is something called a double-sided waterproof flannel. It almost feels like deer fur when you feel it, especially after it's been used for a while. Running through the environment kind of pulls the fibers a little bit, makes it a little bit better for ticks to attach to it. That the waterproof membrane in the middle really helps with drying out. So if you've ever done collection early morning time frame, you get dew on the ground, it gets wet, a little less likely to be attractive to a tick to grabbing onto it. We found that this device, this material dries out very fast. Another name for this product besides double-sided waterproof flannel is crib sheet. This is what people buy to put in a baby crib to protect the mattress from a baby diaper leaking. You can find it in baby stores. A lot of times there's ornate designs on it, so you may not want to get that version of it, but it works really well in my opinion. So how do you use it? Well, a variety of ways. You can poke it up in, kind of use it like a flagging material. You can sweep it around vegetation. It has many uses. So highly advocate it. If you want more information on this, I can provide that. You can email and I can send out a little information packet on it, on what material to get from Amazon, and go from there. So, okay. That's how we do our collection. How do you take those ticks back? Now, a lot of people often use tweezers and files, and we don't use that. We use masking tape and a Ziploc bag. And this makes it very quick and efficient in the field. And for military, that's a very key component, is getting out, doing what you need to do, getting out of the environment and moving on to other missions. What we found works really well is to take a Ziploc bag, about maybe a little bit bigger than a sandwich bag, maybe a quart-sized bag. You can put 3 strips of the 2-inch masking tape on there. And if you can standardize it, 20-minute surveillance per strip, that one bag is 1 hour's of use of surveillance. It makes documentation very easy when you have it standardized like that. Easy to collect ticks off of the material. You can see the picture here in the middle. He's looking at ticks. Just imagine you pull that masking tape off, tap it on, the ticks will attach to it right away, fold it back over, and you're good to go. I want to point out here, like, we don't put the ticks inside the bag. We don't open up the Ziploc bag. The Ziploc bag is just a substrate for the masking tape to go on. And then once you've got it, easy to look at them underneath the microscope. Oftentimes you can identify them very easily through the bag underneath the microscope, or for adults, a lot of times you don't even need a microscope for that. They're captured, they're not going anywhere. It makes it really quick and easy. Now, what do we do with this information? So from the military perspective, oftentimes we're being asked by maybe a commander of a unit who's going to be doing a training exercise, hey, what's the threat of risks in this environment? Well, how we do that is what we call the encounter rate. Very simple. Number of ticks collected over the amount of time we do it. We oftentimes calculate that out to a minute rate. Could be hours, could be minutes, could be seconds if you really wanted it that way. But this makes it very easy for us to convey and to brief a commander who may or may not be scientifically minded. They may not really understand ticks or tick diseases, but they want that information of what's the threat to their soldiers. Doing this is quick and easy, and we can give them good information that they can make decisions on where their soldiers are going to go. Oh, you're going to go to the right, you're going to go down this hill, or you can go to the left, go over this hill, and the risk of encountering a tick is much less going one direction than the other. They have actionable data that they can take and run with it. So quick and easy data. We're not looking at doing scientific research. We're looking at surveillance and getting a quick risk assessment to the people that need that. Well, that's all fine and dandy for activities where people are moving. They're doing that land navigation, or they're doing some sort of exercise where they're traversing across an environment. Tick sweeps work really well to simulate the human activity. So kind of going back to that encounter rate, well, the best use of that is to emulate through our surveillance what that human activity is going to be. Well, what if they're doing a lot of what we call bivouacking? They're kind of hunkering down in an environment, oftentimes where ticks are. A couple of pictures here, you can see soldiers kind of sitting around in that vegetation. They may be sitting there for hours. Maybe they're doing some sort of stealth mission, and they're evading capture or enemies, and they can't, they get a tick on them, they can't hop up and try to get it off. They may need to be very stealthy. Puts themselves in this in this environment where they are kind of a captured situation of attracting ticks to them. So how do we simulate that in our surveillance? We do the CO2 trapping, and you may have done this in the past yourselves. Typical white sheet on the ground and an attraction of ticks. Typically, we're using carbon dioxide through dry ice, and we'll put this out. We'll leave it for a time period. Come back, you can see, the picture on the left. There's a lot of ticks on that cloth. We can then collect them. Picture on the bottom right, you can see using that Ziploc bag and masking tape method. We collect those ticks very quickly, and then we can move on, do our assessment, maybe be doing this in multiple locations throughout a day. So this works very well for those situations where we're looking at human activity of people resting in an area for a prolonged period of time, where they may be attracting those tick species that are more mobile. I can tell you, if you ever deal with the Gulf Coast tick, they are highly mobile. They almost come running into this kind of thing. Okay, I showed this graphic for this table before, bringing it back just because I want to kind of talk about our capability for testing for ticks. We have a wonderful lab manager. She is an entomologist. and stays very up on the diseases out in our region and what's coming down the pipe. So what I want to point out here, the bottom two, we just recently have gotten up on heartland virus and Powassan virus detections, and they're kind of on our radar right now. We've noticed an uptake in Powassan virus human cases here recently, and that's kind of our current focus. Okay, going to switch gears to a different surveillance method that we have, and I want to give a little trigger warning here. So if anybody is squeamish of photos, I'm going to show a couple of photos from collecting ticks off of deer. So give it about 10 seconds or so. If you want to take a little step away or close your eyes, that's fine. All right. So another surveillance method that we use is what we call our deer check station missions. And hunters across the country, every year, we have the fall deer hunting season. And it varies by location, but typically right around the Thanksgiving holiday is opening day. Opening day for rifle is what we target for deer hunting season. And a lot of military installations do allow hunting on post. So what we like to do, and we do this maybe 1 or 2 installations a season, is to piggyback with that opening day of deer hunting season. What we're looking for is, as a pun intended, is to get the biggest bang for our buck. We're looking to go to a location. Oftentimes it's a weekend trip, and our target is to get at least 50 deer in. So installations where they suspect that they will have about 50 or more deer come through opening day, we link up with that. It also has to be a location where the deer hunters have to bring the harvested deer in for aging, sexing, checking for diseases. It has to go to a central point where we can be at that point and pull ticks off of those deer. Our protocol for this is spending 5 minutes per deer to remove ticks. And that can be a significant number of ticks that are removed. I mean, we sometimes our catch can be up in the 600-700s of ticks that we bring back. So it's a really good method for us to collect a bunch of ticks from a specific area, and also supplementing the environmental surveillance that I've previously mentioned. We do get different tick species through this than through others. So trying to get that comprehensive view of what's going on. We can also pull blood samples from these deer and test that for the pathogens as well. Okay. Quickly touch another thing that we deal with is insect repellents. We do a lot of education on what is a proper repellent out there, such as the picture in the bottom here. That's a plant-based, DEET-free. DoD has done a lot of research on efficacy of repellents, and really we only have a few active ingredients that we recommend. DEET, picaridin, IR35. So we're oftentimes doing education situations on insect repellents and how to use them efficiently and such. And then touch on, we do a lot of outreach opportunities. With entomology, you can do the fun outreach where you're bringing in Madagascar hissing cockroaches, and kids hold them. We prefer to do something more educational. So a lot of times we'll do such a situation. You see the bottom right picture. Are you protected? 10 minutes of tick dragging along the hiking trail this morning. So that was an Earth Day event. And first thing we did when we got there is went out and did tick surveillance, collected all those ticks. We had our little station right at the trailhead of a hiking trail that people were allowed to do. And we were able to capture them and be like, hey, did you put repellent on? And then show them this and kind of do those teachable moments of, hey, you're putting yourself in an environment and you need to protect yourself. Couple of case studies. So first one is going to be the Boy Scout Jamboree. This one's a bit older, and I'll talk about that in a minute. And then the other one is a ROTC program. They have a summer training event. So the Boy Scout Jamboree. Back in the 1980s, the Boy Scouts started using a installation in kind of central Virginia to host the Boy Scout Jamboree, which occurs about every 4 years or so. And this brings in between 25 and 40,000 participants, everything from the scouts themselves, the scout leaders, and all of the support staff. So thousands of people come in to an environment, and that environment is pretty heavy with ticks. So what we have done over the years is support them in a variety of methods. From the year before the event, we go out and we do a lot of surveys to get a threat map. You can see our threat map from the 2010 Jamboree, which was the last one done on this military installation. After this, Boy Scouts actually bought their own property and host their Jamboree on their own property. But up until 2010, it was on Fort AP Hill was the installation. And you can see that threat map. We created that based off of predictions from the year before to give a good idea of like, hey, where are these higher risk areas? And then we can do some habitat reduction in that year from our pre-survey till the actual Jamboree. And then while the event was going on, we actually mobilized our pathogen detection lab and did on the spot tick pathogen testing. So if somebody had an attached tick, they could go to a medical service tent, have that tick removed appropriately. And within about 24 hours, we had the results of that tick that we could then get back to that person. So get really quick turnaround time to give them some good information in case that tick was carrying a disease or, well, pathogen. More recently, though, is the ROTC Cadet Summer Training, which occurs at Fort Knox. It used to be spread across a variety of installations, but in 2014, it was all consolidated to Fort Knox, Kentucky. And from that point, we, Public Health Command East, have supported Fort Knox in a variety of methods to ensure that those participants in the CST are protected from tick-borne diseases, as well as a variety of other Ento-related health risks. The CST ranges from about 15 to 20,000 participants each year over the summer months. And they come in and they're doing that field training stuff. They're learning to be a soldier. So they're hitting the ground, they're sleeping overnight in tree lines. They're doing all the stuff that puts them at risk of ticks in that tick habitat. So what we do is typically we do 2 missions each year. We do an early spring mission to look at habitat, look at things that we can do habitat reduction, pre-camp assessments. So in the early years of the CST, they did a lot of these big tent city training areas. But in more recent years, they do a lot more overnight hiking. And so that mission for the CST has changed over the years, which has made the risk of ticks different. And so every year we kind of go back, and I've been doing it since 2014. So I have a very personal historical understanding of what goes on there. And I can help reduce that habitat. And then our second mission that we do involves the public health assets that are going to be there during the summer training. They have a public health task force, and we go back to help set them up, because every year it's a different detachment unit that will come and be doing everything from water testing to tick surveillance. And so I kind of have that continuity of historical understanding, and I can train them. And it's been very successful to help reduce those tick threats to all of these cadets, as well as the support personnel. Some of the things that we do during this, you can see this picture in the top center, Baker through the years. That's one location with the same general location, photos taken from different years. You can see how it's changed over the years. We do site evaluations, looking for habitat that needs to be reduced through mowing options, things like that. And then, of course, our general surveillance methods. Okay, last topic is just some resources for the Department of Defense personnel. MilTIC, that is our program, not R as in Public Health Command East, but as DOD, the MilTIC, the Military Tick Identification Infection Confirmation Kit. A very beneficial program to all service branches, their dependents, retirees, DOD civilians, and in contractors. If a tick is attached to any of those personnel, it can be sent to the tick lab at Aberdeen Proving Grounds and tested for any pathogens. And it's a very well-run program. And the requirements are those particular DOD relevant personnel, and the tick has to be physically attached to the person. It does not matter where it was collected, if it was on DOD property or somebody was in their backyard, that all applies. Other resources, we advocate for what's called the DOD insect repellent system. That is permethrin treated uniforms, putting on the skin repellent on any exposed skin, and then using that uniform appropriately, not rolling your sleeves up, things like that. Most military uniforms are now factory treated with permethrin. So we've taken that user error potential of, you applied a spray permethrin, but you didn't do a very good job of it, so you have failure points. Having the factory treated is really kind of taking that out of the picture. So Army, all field uniforms are factory treated. I think some of the Navy uniforms are not. And so that still relies on the service member to create an application for their uniform themselves. And then we push out a lot of public affairs information, everything from posters, such as this particular one on how to use that insect repellent system for sleep. This one I created specifically for that CST mission. But we do a lot of flyers. We put out public service announcements. If we have a particular issue at an installation, maybe elevated cases of, say, Lyme disease, we will put out information to the community, letting them know what the situation is and advocating for all the use of that personal protective measures. So those are a few resources that we have for personnel. And that pretty much wraps up my presentation. Kind of went through a whole lot of stuff. So I think we may have a few minutes to spare for any questions, as well as the poll question. I'll turn it back to Ryan.
Thank you. It was a great presentation. I'm going to launch the poll question, and while you are answering the poll question, please put any questions in the chat or raise your hand, and we'll hopefully get a few questions in here. First question I see, Monica asks, how often are uniforms retreated with permethrin after they are used? X number of days, X number of washings. How is this monitored for effectiveness?
Wonderful question. Actually, I had that was posed to me this morning through email through some other personnel. The basic answer is there is no retreatment for factory treated uniforms. And as I mentioned, the Army uniforms are all factory treated at this point. Some of the Navy ones are not. So if it's factory treated, EPA does not allow any retreatment. And the reason for that is we don't know what the level of permethrin is in that uniform. So some of our research labs, the ones that kind of research how to make the factory treated uniforms, like the materials and all that, they're now trying to figure out a non-destructive method to evaluate how much permethrin is in that material. I've seen a presentation on they can test it, but the current method for testing is to take like a hole punch and cut out a hole from that uniform, and then they can take it over to a lab and do testing to evaluate how much permethrin is in it. But that's a destructive option, and so that's not viable for us. You know, they can't be putting holes in their uniforms. So as of right now, factory treated, that's off the table. If it's not factory treated, there's a variety of methods that the Navy uses to treat, to do initial treatment, everything from aerosol cans to putting it in a bag and letting it soak. So that the answer for those is it depends on which method it was treated with. Those sprays don't last all that long, so they can be retreated more often and quickly compared to the other methods. But the general answer is it depends on how it was treated.
Thank you. I'm not seeing, oh, here we go. So the follow-up, so is there a false sense of protection if factory treated uniforms are used more than 70 washings?
So the standard for the factory treated is it still should be 90% effective after 50 washings. Is that true? I don't know. We're still trying to figure that out. Depends on how often it's washed. It's not just the number of washings, but how frequently, what temperature it's been washed at, the different types of detergents. So we're still trying to get a handle on how effective these are after those washings, but anecdotally, I think there is a bit of false protection. I know a lot of the soldiers that I work with, their older uniforms, they're not being as protective as they used to be. So I think that there is a false sense of security in there. And so there really is a push to get those factory treated uniforms to where we can retreat them. But at this point, it's not on the table. EPA will not allow that. So to add to that, we have to very heavily push, the use of the skin protection with that.
Great. Does anyone else have questions? Put them in the chat. You could raise your hand. You could just unmute and start talking. Any and all methods work.
I think what I'm going to do is that I've mentioned the tick sweep, that I have a little document on how to create those. Ryan, I think I'll send it to you, and if you want to send that out, you could send that out to everybody in the group.
Sure, we can do that. Yeah.
I've been using that for so many years, and it just is so much more effective for my purposes than the standard sweep and flag, or the standard drags and flags that most people use. So I'd like to get that out there. So I'll send that to you after we're done here.
Sounds good. Yeah. I can put that out to everyone. If there are no other questions, we are a few minutes past our normal time. So we could let everyone go. James, thank you very much for this presentation.
Thanks for the invite. I appreciated it.
And thank you all for joining. We'll have this up on YouTube shortly for review or to share with your networks. And I will have resources for you as soon as I get them from James here. So thank you all very much. We will see you at the Tick Academy. And as always, please email me if you have any questions. So thank you.